surgery is slow to change, but has undergone significant changes over the past 50 years. For example, we used to do all procedures with big incisions and now we've really started to do a lot more what's called minimally invasive surgery, where we can do similar types of procedures through smaller incisions to deliver smaller instruments. We still do large open surgeries, but there's a lot more emphasis on trying to use technology. So robotics has become a big part of a general surgeon's practice, and in some subspecialties as well. And surgical culture and the training itself has changed. It used to be that 20 years ago, it was a resident doing a case by themselves in the operating room with an attending surgeon nowhere in sight. And now there's a lot more structure and feedback in order to try to make sure that the surgeons that we're graduating know how to do procedures and are safe to do them independently. I think if you're coming at it and you're an undergraduate, then you have a lot of time. And chances are you're going to change your mind a lot during the medical school process. I know that I came into medical school wanting to go into a different specialty. And then even during my third year, which is typically when people decide and apply into the specialties ultimately that they're going to be in, I changed. And you see, even in general surgery, for example, 20% of applicants ultimately leave after their first year of residency to go to another specialty, whether it be anesthesia or something else within medicine. So you have time. And if you're interested in surgery, then good for you, and do your homework and pursue that specialty. Get connected with surgeons, do clinical experiences if you're interested in research projects, because that's a good way of getting connected with surgeons, then for sure do that. But if you ultimately ask yourself, am I willing to make the sacrifice to my time and training years to do this? And your answer is no, then that's okay. Even if you've spent years wanting to do that specialty, you can go into something else. Nobody's going to judge you for it. People have those types of conversations with themselves. So I would say if you're interested in surgery at this point in your careers, keep on pursuing it. Once you get into medical school, then you can start really pursuing those clinical experiences more and becoming more familiar with what it takes to become a surgeon. And then it's ultimately a personal decision with whether or not you want to continue with it. And there's no pressure one way or the other.